Did you know that there's an easy way to determine if you're healing properly after stem cell injections? Well, that's what I'm covering in this video. My name is Dr. Garcia. I'm a leading expert in stem cell recovery. I'm excited to be able to help you heal better and know that you're on that right path. Well, there's three things you need to look at when you're talking about how to assess if you're healing properly. The first thing you have to do is look at what is normal. How long does it take to recover after stem cell injections? Well, the first 12 weeks after stem cell injections, your body is feeling achy, maybe a little stiff, maybe a little swollen, and that's very, very normal. Most people take about 12 weeks to feel like they did before the stem cell injections, where they can move again and walk without much discomfort. Then the next 3 months are all about feeling better. Now, the question a lot of people have is, well, in those first 12 weeks, how do I know if I'm on the right path? How do I know if I'm healing correctly? Well, I'm gonna describe three things that you can measure and assess as you go along your journey. All right, so the first one, when we look at progress, most people expect, well, I want to feel 100% better after stem cell injections. And while you will get as close as you can as to that point, you have to understand it's not going to happen overnight. And it's actually not going to happen in 3 months. And it's probably not going to happen in 4 months. For many people, it's minimum 6 months. And a lot of people need to understand that. So in those first 12 weeks, how do you know that you're on the right path? You just need to know that you're improving about 5% better every single week. And for a lot of people, that's very tough to realize. Well, only 5%? Well, actually 5% over 24 weeks is about 100%. And 24 weeks is about 6 months. So as long as you're getting better incrementally every single week, that adds up. So for many people, they get frustrated. They're like, I want more. I want to be able to do more. The challenge is the stem cells need to be able to do their job. They need to go in and repair the tissue. And if you're trying to expedite this, you can't do more activity. You have to allow for slow, steady progress, especially in those first 3 months. Do not push it. So you know you're healing properly when you are going at about 5% weekly improvements. The second part is, how do you know that you're progressing appropriately? Is that you're bored and you want to do more. You know, we hear this from all clients all over the world. I want to do more. I'm only in 6 weeks after my injection, or 10 weeks after my injections, or 4 months. I just want to do more. That's how you know that you're on the right track. Because if you weren't on the right track, you would be having setbacks, you'd have flare-ups, you'd be doing too much, and you figured out the hard way that you were doing too much. So if you feel like you're moving slow, if you feel like you're bored, if you feel like you're hungry for more, you're on that right track, because you're holding yourself back to make small incremental improvements every single week. So number one, 5% weekly improvements. Number two, that you're bored and you're hungry for more. That tells you that you're healing appropriately. And number three is that you're having minimal setbacks. We call them flare-ups. Flare-ups is this concept where, imagine you just had injections and you aren't able to bend forward or lean or sit for a long period of times because your back is pretty achy. And maybe you were playing with a kid, a grandkid, and they were about to fall, so you moved very quickly to save them, and that flared up your back. Well, what's the difference between that and a small little twist? Well, a flare-up by definition is an issue that you now have to recover from for about 48 to 72 hours, that your back is kind of flared up and you don't know if it's an improve, and it takes about 2 to 3 days. That's a setback, that's a flare-up. And what we're trying to do is reduce those. And I would expect in every single month of your recovery process that you have at least one of those per month. Those are pretty normal. Now, the problem with a lot of people after recovery is that they want to push more, they want to do more, they're bored, they're hungry, so they just push. Well, they have a setback. Well, that's only because you didn't align with 5% weekly improvements. You didn't align with being patient, and instead of being bored, you chose to test it. Well, you're gonna have a flare-up. When every time you have a flare-up, it slows your recovery process. So the best way to know that you're on the right path is to go slow, be bored, and have no setbacks. That's what you're allowing these stem cells to do. The reason why you have a difficult time with this is because you're a go-getter. You love to move, you love to be on your feet, you love to be able to just go and be active. Well, the challenge is You sought out a service, stem cell injections, to allow you that freedom so your body feels better so that you can do it again. The problem is you're trying to expedite that. You had the injections and you expected them to work overnight. So therefore, you want to get back to being active like you were in your 20s, all because of your expectations. So one of the best things you can do is realign your expectations to what is normal and what do I need to do to accommodate this. First part, 5% weekly improvements. Number 2, that you're bored and you want more. And number 3, that you have no setbacks. That's how you know that you're healing on the right track. And if you have been healing from this and you've been on track, or you've been concerned, or you haven't followed this protocol and now you're struggling with your results, well, the great news is me and my team at the Stem Cell Recovery Experts can help. And one of the best things we do is we start with people just like you, go through some diagnostic testing. This is online, virtually, to be able to assess, well, what went wrong? What were you doing incorrectly? What were you told to do that maybe was a little too much? Or are you going way too slow? You're being too conservative, too aggressive. And that helps you determine, well, how do I get back on track? Or even more importantly, how do I stay on track? So if you feel lost and you want to know if you're on the right track or stay on that right track, reach out to us at the contact information below, and we'll be able to point you in that right direction to get started on getting healthy again and feeling like you did 10, 20, 30, 40 years ago. We're excited to help, and we're excited to help you along your journey. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on recovering safely to create long-lasting results after stem cell therapy. Thanks, and I'll see you soon.